ever found yourself in an important meeting suddenly convinced that your bladder is the size of a pea and panicking about making a dash for the bathroom? Well, spoiler alert, your body might be sending you fake news. That urgent, gotta go sensation could actually be your brain's sneaky way of saying, I am terrified of failing in front of these people. So zip up, sit tight, and prepare to learn how your anxiety about being a total disappointment might be disguising itself as nature's most inconvenient call. Dr. Adina Aldea will show us how to recognize these behavioral footprints, and you'll get to see us use exposure and response prevention techniques to stop letting bathroom breaks interrupt our breakthrough moments. Let's go. Dr. Adina Aldea, I am so excited to have you on this podcast today. I'm especially excited because I know this is your first podcast, and we are actually popping your podcast cherry.
Absolutely.
And so my goal here is to make it so nice and tender that you want a podcast all the time.
Like that idea. And thank you for having me. I'm really excited about this.
Yay. So I know your daughter gave you a bunch of don'ts, and I'm going to say do. There will be singing, there will be swearing, there will be eyebrow raising and face scrunching.
Yes.
You've got a lot more movement in yours than mine right now. But
Like in a real session, like
Yeah.
in real life.
like in real life. So we'll just jump into it. So I don't know. Do you want Dr. Adina? Do you want Adina? How do you want me, and how do you want the world to reference you?
Adina is just fine. I'm not particularly formal. I'm actually quite informal. And honestly, I do not need to be called by my title to remind myself what I'm worth, what I'm good at, what I can and cannot do. So Adina is just fine.
Adina, I love this. So give me a little bit of your background. I introed you already, but how is it that you came to be an exposure and response prevention and an OCD specialist? And talk to me a little bit about your path and what this work means to you.
Well, the short answer is that I fell into it by accident, actually. My research in graduate school during my PhD program was on perfectionism. So there was a little bit of linkage there, right? Adaptive versus maladaptive perfectionism, more of so the factors that affect one or the other or feed it versus the clinical piece. Historically, I never really liked or found it very satisfactory to do like general therapy. I found it quite exhausting, as a matter of fact, so much so that I decided to go into research and remain in academia. I did not want to be a clinician, but I did want to get licensed, so I decided to do a fellowship. And because I was constrained geographically, I applied for this clinic that I heard about. This was an OCD and anxiety clinic at the University of Florida, and somehow they accepted me. And I fell in love. I found my clinical thing. And it really, 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 really clicked. And I've been doing it for almost 20 years now and enjoy every second of it.
What would you say your favorite part of the work is? Like, what do you do and then leave a session being like just totally invigorated?
I think about this pretty often, actually. I think it's the change. I think it's seeing people suffering, not being able to function, being quite miserable, to actually moving forward in life, being able to do things they always feared, being able to enjoy life, being able to take a job, being able to spend time with a family that's meaningful versus fear-based. And to me, that's priceless. I don't know if I've seen as much change as I see with ERP in any other forms of therapy, actually. And since I'm very action and results oriented, that's extremely reinforcing to me.
Yeah. What do you attribute that to?
Which part?
The part where you see more visible outward change as a direct result of ERP. Like what process are you identifying in ERP that is like contributing to that?
Well, and it's also what we know that research, not from research, not just my observation. It's the actual doing. When we're anxious, anxiety makes us avoid things. Anxiety makes us withdraw. Anxiety makes us afraid, and it renders us helpless in many aspects of our lives. And when we replace avoidance with action, then it pays off, and we start moving along in life. So, yeah.
Yeah, I appreciate that note about action. One of the things we really tried to touch on in this show is first, like taking this values forward approach to life, right? Like really being able to identify your values and what matters to you. But the really key component to that is taking small steps. And without those small steps that your values, great, but like what are you going to do about it, right? Like sit in your room and think about how much you care about being a parent for the rest of your life? No. You need to take the small steps in order to actually start seeing your life change. So I really appreciate you putting your finger on that specifically.
Small, realistic steps. That's another piece, because many times, right, we want to take steps, but we maybe think too big or want too much, and that becomes inhibiting because one, we're not ready, two, is just too much for where we are in life. So how do we break it down? And I think this is where the art of ERP is, right? It's not a one size fits all. It's really meeting the person, each client, where they are and what is it they can do. What is that next step they can take? Otherwise, it's just a power struggle. And I think that's what feeds a lot of misconceptions about ERP.
Yeah, I find myself thinking about someone that I worked with who, after COVID, hadn't left their house for a long time. And we set this goal for them to be able to get to downtown Seattle. And they had been in their house for years. And because of ERP, we identified these really small steps that they could start taking. And the first step was literally just to go to the mailbox. And I met them at the mailbox. I was like, I will meet you at your mailbox and we will have a session sitting at your mailbox. And then the next session we'll go someplace else. And over the course, it's been really slow going. We talk about them being a little bit of a starfish. They're moving, and there's like a lot of tentacles down there, like making that movement happen. But it's slow going, and that's okay because that's just where they're at. And so, but we're in downtown Seattle now. We're meeting in downtown Seattle, and it's amazing. It's really, really amazing to get to do this work. And so I'm really excited to get to model a little bit of that today. And yeah, so before we jump into it, for the listeners who aren't familiar with exposure and response prevention, I wonder if you could just give how am I going to phrase this? A not too jargony explanation of what this therapy is, how it works, and what we see as a direct result of it, or what we use it for as well. Add that in there.
Okay. So exposure and response prevention is a very specialized, very specific form of cognitive behavioral therapy. And, people are more familiar with that. The principle, right, the basic tenets behind cognitive behavioral therapy is that thoughts, feelings, and behaviors affect each other, right? The way I think is going to affect how I feel. Like, for example, if I think I'm a dumbass, no good, useless person, right, I'm going to feel depressed, of course, which is going to affect what I do. In this particular case, I feel like I'm useless, no good. I'm going to feel depressed and I'm going to isolate. The more I isolate, the more I have time to think. What am I going to think? Oh, what a terrible person I am, which is going to further feed the cycle, right? So the same cycle goes, it applies to OCD, right? The thoughts are the obsessions or the intrusive thoughts, right? Oh my God, if I touch my desk, I'm going to get sick. I'm going to get other people sick. Bad things are going to happen, right? And as a result, I'm going to feel anxious. And what do? Either wash my hands, or I disinfect, or I avoid altogether to touch the desk. And this avoidance further reinforces my fear that, touch, I'm going to die. Bad things are going to happen, right? And, we're prone to avoid things that make us scared.
Evolution.
Yes. So actually, what seems like coping, washing our hands in the case of, fear of germs or fear of getting sick, washing our hands, avoiding contact feels good in the moment. Feels good. And that's why we're more likely to do it over and over and over again. And the cycle becomes deeper and deeper. And the problem with our brains is they generalize fear, right? So our fears grow to all kinds of other areas. And then we get stuck, right? To the point that many times people get stuck in their homes, unable to function properly. As I said before, quite miserably. So this is where ERP comes in, right? The idea is to break the cycle. Um, in anxiety and OCD, OCD is a severe form of an anxiety disorder. Because the anxiety is so overwhelming, right? This is what the focus of the people who suffer from it is, right? To extinguish that anxiety, to get rid of it, right? Because it sucks. It feels horrible. It's been doing this for 20 years, and what describes best what people experience is feeling. Yes. And people who suffer from it can actually relate to it quite a bit. But we do not have any direct control over our emotions. We really don't. I can try to convince myself to be happy. It doesn't mean I'm going to be happy right this second. Yes. So we affect our emotions, in this case, the level of anxiety, the level of distress, by changing what we do, how we do things, and of course, how we think about things. But once we start doing something differently, right, we're going to automatically think differently. And this is the huge difference between ERP and general cognitive behavioral therapy, because in general cognitive behavioral therapy, the emphasis is on cognitions, on changing how you think. Less effective, actually quite ineffective in OCD, because you cannot talk sense into the nonsense. In anxiety disorders in general, right? I know rationally that I can touch this desk and lick my fingers, right? But I still cannot do it. So the doing it is really, really, really crucial, really facing those fears. Again, in a step-by-step fashion. So that really breaks that anxiety cycle and also fosters a sense of confidence, right? Oh, I could do this. Well, maybe I'm not as helpless. And also, more than anything, ERP is a series of behavioral experiments, right? Once I do something and I learn that the feared outcome didn't happen, right? I licked the disc. I did not die. I didn't get sick, right? That kind of breaks that assumption that our fears make that, oh, bad things are going to happen. And I'm more likely to do the next step and the next step and get my freedom back.
So in traditional CBT, traditional cognitive behavioral therapy, say my client where we've gotten them out of the house, the strategy might be to think about different perspectives on leaving the house, or how it's not going to be as bad as we think it is if we leave the house, or to use these sort of like cognitive gymnastics to try and like coax our way into leaving the house. Whereas ERP is like, we're not going to even bother with anything you think about leaving the house. We are going to leave the house, and then we'll talk about what it was like to leave the house after we've left the house and returned to the house. And then what I hear you saying is doing that over and over and over offers this new learning experience that then starts to shape the way that you think about the experience. And so operating more from this experience instead of from what fear says about it, and trying to talk yourself out of being afraid. You go out and you live the experience, and in as much as you don't die from that experience, like you have this new learning opportunity. And if you do die, it doesn't matter because you're dead, and our malpractice insurance will cover that because you've signed waivers.
I mean, in a more simplistic way, right? How do you decide whether you like a food or not? If you don't taste it, you don't know. There is no way of knowing. You operate on assumptions. This is not different. Is this going to kill me or not? Well, there's only one way. There's only one way to find out.
Love that. And I love that you brought up food specifically, because I think with food, it comes baked in with all of these assumptions, right? Because foods can have very different cultural um, biases sort of like wrapped into them. And so there are all of these underlying beliefs that are largely flawed and influenced by some really sort of like old and archetypal and like assumption based generalizations. And so, yeah, I love this idea of like trying the food. Like just let's try the food and we'll see if we like it. And then if you hate it, you can spit it out. Sounds good. Or you could swallow it, probably won't kill you. Acceptably low probability that eating food that you hate the taste of will also kill you.
Mhm.
And yeah, what a great parallel.
Going back to the doing, right, in ERP,
Yeah.
actually, we know from studies of the brain, MRI scans, etc., that when we change our behaviors, that leads to actually changes in the brain pathways.
Mm,
So it's actually not this psychological mumbo jumbo
mm.
type of thing. What happens actually has physiological correlates. When you do things differently, our brain actually, this is an exaggeration, but for the lack of a better word, kind of like resets,
Mm.
develops new pathways. So it's actually a very, very powerful approach.
And fast.
Mhm.
Much faster. I was sitting with a client the other day and they were like, "Why is it that I have friends who've been in therapy for years and years and years and they're still trying to like figure stuff out? And we did therapy for like 16 weeks and like my whole life opened up."
Mhm. Well, speaking of that, I have clients who come to me as like, I want to understand, I want to know why I'm
Yeah.
experiencing this. And, pretty much my standard response is, well, we can spend another 10 years trying to figure out why. Because OCD, anxiety in general, it's very complex, right? It's not only just one cause. It's not always your parents' fault, really, truly. Uh,
Unless you are Adina's daughter, in which case it 100%.
that's all my fault. Yes, of course. Um, Yes, we can try to identify why, and knowing why doesn't change the fact that we're stuck. Many times we understand why, but it doesn't change anything. So it's about doing, and let's make the changes to move forward. Let's make to do what it takes in order to reach whatever values and goals one has in life.
That's also a really helpful perspective, this idea that you don't actually have to figure out why this is happening or why you're feeling anxious or why
Mhm,
you are afraid of this thing in order to move forward with your life.
mhm,
That you can both know that there are some contextual cues that will bring this up. Like that is helpful. Like,
mhm,
okay, like we can like look back historically and see, oh, it happened here, it happened here, it happened here. And we don't need to figure out why it happened there because that's
mhm,
just more digging. And we can use those contextual cues to inform our work, but we don't have to dig so deep that we find the reason. Like
mhm.
that, there's an acceptably high probability that we will just end up digging for 10 years and never find this golden
And
nugget of truth.
speculate for
Yeah.
10 years.
Thank you so much for that clarification. It is absolutely speculation. So Brenda, you know about Brenda, my mind, she is a
Mhm,
wonderful storyteller. And
mhm.
her stories are usually pretty catastrophic, sell me short at every chance she gets. And if I just listen to her series of why and dig with her, my life just passes me by.
Mhm.
Um, yeah. And so I know that for me personally, I have found the most traction in just doing something. Like I don't actually need to know why I'm not going to the gym in order to like put my tennis shoes on and go to the gym or even just go
Mhm.
for a walk. Right. And so, yeah. So again, so helpful in that there are some really important things to discover in examining our history. And and that is not to say that that examination is about determining why.
No, it's more so what it's particularly helpful in, OCD and anxiety disorders in general. This applies to pretty much any anxiety disorder.
Mm,
Um, it's, figure out where the core fears
mm,
are, right? Because, the reality is it's not the fear of germs in and of itself, for example, right?
mm,
Um, I, in my almost 20 years of
mm,
experience, I see OCD as anxiety. Yeah, OCD and anxiety in general is deeply existential. It's that over exaggerated, fear of suffering and death that we all have. If you dig deep enough, this is what you find. At the core of it, that's it. That's it. We all have it, right? But leave it to OCD to uh, make things huge.
mm.
Yes, turning a good thing into a not so good thing. It's too much of a good thing, right? We want to have a little bit of existential dread. Yes,
Sure. Yeah, don't
you
step
know,
in don't step into the street.
exactly. And all kinds of other things, right? But it's too much of a good thing. Yeah, I want to wash your hands. It's a good idea to be clean, right? Washing your hands 50, 60 times a day? No good. Yes, being thoughtful and being a good person. It's a good thing. Yes. That's too much of that turns into a doormat. No.
So helpful there too, because it's really about there are behaviors that are functional, and then there are behaviors that become dysfunctional. And then there are behaviors that are just totally non-functional, that like we're just going to stop tapping stuff. Like you tapping stuff is not actually functioning to do anything. You washing your hands, helpful, totally helpful. Let's
This much.
rein that behavior back into the realm of function, right? This much. You only need this much hand washing in order to like be safe enough. And as a parent, I know that for me, hand washing, I'm like, yeah, that's great in theory. And also, my toddler is sticky. And if I were to like adequately wash her hands to like cleanse, I'm just sort of embracing the fact that like there's probably pee on her hands and also dirt. And also she's going to put them on my face and in my mouth. And so they're like, I know I'm always doing an exposure with regard to hand washing. And, I don't know about you, but like do we wash our hands every time after we go pee? I don't know. I kind of don't. I just sort of like move on with my
But
life.
that's the question. If you don't wash your hands, your toddler puts their hands in your.
But did you die? I love this mug. I love this mug.
My clients say this a lot. Yes, because it's, the discrepancy between what we expect to happen versus what actually happens. Is it gross? Yes.
Yes, absolutely.
Is it a little bit unsafe? Yes.
Sure. Enough.
But.
But did you die? Nah. Still
And I
alive.
think, speaking of, there's a story behind this. Not the mug, but this expression. Actually, I'm Eastern European. I grew up in Romania, and my maternal grandmother was very important to me, and we're very, very close, and she was very integral part of my growing up. Yes. Anyway, in retrospect, I think I was quite an anxious child, as a matter of fact. And she would always tell me, because I was afraid to do anything, right? I was really afraid. And she was like, just go ahead and do it. If you die, I light a candle for you. And when I come back after doing it, she was like, but did you die? Do I need to light a candle for you?
Yes. Yes.
So, probably that's why this work just makes so much sense to me. It's so intrinsic. It's a lifestyle.
Yeah. Yeah. Yeah.
Yes.
Okay. Let's do a little bit of the work.
All right.
It's going to be, I'll say right now, it's going to be a real play. Sometimes I'll do role plays and I'll just make stuff up. Nope, this is real play. This is like real content that I struggle with. And God, I feel it even rising up in me now that like, oh my God, panic. But you know what? Giddy up. Let's go. Let's jump in. So
what's going on?
Okay, so here is here's the issue that I find myself facing. I start to feel really, really anxious before I do certain things, and I notice this pattern in it, right? Like I feel anxious before I go to bed. Like it happens there. I don't have any trouble falling asleep, but I feel really anxious before I actually like get into the bed. And then when else does it show up? It shows up before I go into a session. Shows up before I go into my Pilates or like a yoga, anything where I'm sort of like locked in. I feel like I'm locked in, but not locked in like a trapped, I'm on an airplane and I'm trapped kind of sense. Like it doesn't necessarily happen there, but it's like I'm locked into a situation where I can't necessarily remove myself
Easily.
Yeah, exactly.
Not trapped, but not easy outing. Out.
Yeah, exactly. Like there will be some sort of and it's not necessarily, yeah, I guess it's I don't, maybe I don't want to make people uncomfortable. I don't know specifically what.
But what is it that makes you anxious about the situation? What is it that you fear, right? Anxiety is fear. Most of the time, irrational fear.
Yeah.
So what is it that what is it that you're concerned about in those situations where it's not that easy to get the hell out?
So I'm going to say it. I am concerned I'm going to have to go pee in the middle of something.
Okay.
And like I don't have any urinary incontinence. Like there's no, like we're not concerned about having an accident and making a mess all over I sit on a yoga ball. I'm not concerned about like peeing on the yoga ball in session
Mm-hmm.
or um
Good.
but I am kind of concerned about being on the yoga ball in session, like having to go pee so bad. Is it about pee though? I don't think so.
Mm-hmm.
I don't think it's about pee.
So you are saying that it's not about actually peeing, but it is, but it's not. And this kind of internal struggle, like what is it?
Mm.
Right? It's not uncommon. I'm kind of redirecting here a little bit.
Sure.
Because it's kind of like a battle between your rational mind or your irrational mind, right? Your rational mind knows I can hold my pee, as you mentioned before. I don't have an UTI. I don't have physiological issues that would lead to an accident. Yes.
Mhm.
But this has nothing to do with your rational mind, right?
Mhm.
This is your irrational mind. Your Brenda, you called it?
Yeah, Brenda.
Yes.
Yeah, she's busy.
Yeah.
She's real worried about this.
Yes. Yes. And it's actually a good idea to always name this, anxious mind that we have, because, this is not who we are, right? That's anxious. If we have this, right? It's good to see us as somebody outside of us, right? Like a bully in our heads messing with us. So, in your rational mind, you can't even conceive, like, really, I'm afraid I'm going to pee myself, really? Like, no way. So we tend to dismiss these thoughts, yes. But they're still there. They're in the back of our mind, not in full awareness. And remember, I always keep this, the cycle, right? In the back of your head, you think, oh man, oh shit, I'm going to pee. It's going to be embarrassing, right? It's going to be
So
terrible,
embarrassing.
right? So you're going to feel anxious.
Mhm.
Yes.
Mm.
But these are not in full awareness.
Mm.
Yes. And that's not actually that uncommon with OCD, that the thoughts kind of lurk in the back, but not in full awareness. And that's why many times in treatment, it takes a little bit to actually figure out what the obsessions are. It's like, I don't have any obsessions. Well, you're not fully aware of them. It doesn't mean they don't impact you. Yes. So you are in a yoga class and you're anxious right before class. Yes. What's the first thought comes into your head? You're going to a class and you have to pee. What's the first thought?
I should go pee now.
Okay. If you don't, and if I don't?
I literally don't ever question it. I just go pee.
Okay, but let's play along. If I don't pee, then what?
Okay. If I don't pee, then I will have to go pee in the middle of the yoga class, and I will either disrupt everyone in the class who is like locked in to tree pose or some like intent, like it's going to happen in a balancing pose.
Of course.
And I'm of course I'm going to disrupt everyone there. And
what's going to happen if you disrupt everybody there?
well, they will all
Then
fall
what?
out of their tree poses and then be upset with me for being disruptive.
And what happens if they get all upset with you?
Well, then I can never go back to the yoga studio.
And
then I have to go to a new yoga studio
and
make all new friends where I will just face the same fate. And so then I will have to like cycle through all of the different yoga studios in Seattle, and I will do this like disruptive
you're going
thing.
to ruin them all.
I am going to ruin all of the yoga studios in
And
Seattle.
the whole yoga community is going to hate you.
The whole yoga industrial complex will hate me. There will be
Now you're laughing.
no, because I know I hear the
What do you hear? What do you hear? Don't minimize this. What do you hear?
Yeah.
What do you hear?
Like how important it is to be like connected, and like I hear how absurd it is.
Okay, so if you hear somebody else saying this, right, your reaction would be like,
I think it's probably gonna be okay.
well, that sounds like reassurance to me, right? But somebody told you, the whole yoga community is going to hate me. What would be your reaction? Yeah, buddy, that's right. Or you'd be like, really?
Yeah, are we sure about that? How do we account for the fact that it happens before bed too?
What's the fear there, right? You are about to go to bed. You feel anxious. What's the thought that pops into your head?
If I have to get up in the middle of the night, I will disrupt my husband, who is sleeping so peacefully.
And
then he will be upset with me and hate me. And then he will divorce me and leave me.
And
then I will be alone
for the rest of your life.
For the rest of my life.
You're going to die alone.
Most likely.
See, you're laughing again. Why do you think you're laughing?
I'm laughing because it's uncomfortable to like really consider the like
Uh-huh.
enormity.
But does it sound when you hear it? When you hear it, how does it sound? Rational, irrational? Like, oh, yeah, that makes sense. Yeah, that, yeah.
No, it sounds again absurd.
Okay, so we tend to laugh at the
Yeah,
absurd. Yes,
yeah,
that's why you're laughing. Yes, because it is absurd.
yeah.
English, Romanian accent is kicking in. Uh, yes, it is. It is ridiculous. All right. Now the question is what we're going to do about it. Do you have any water handy?
No, I mean I have my I have my cup. I don't know what's gonna happen, but something's gonna happen.
I think it's time to gulp up some coffee. You see, you know.
I'm gonna be jacked by the end of this. So not only will I will have a full bladder, but
No, you're not going to have a full bladder because you. What are you afraid of doing? Disrupting? Yes.
I'm gonna I'm gonna pee myself. Or
Well,
and
rather than disrupting.
well, I'm gonna disrupt this. Oh, holy fuck! Do I have to disrupt us? Do I have to leave? Oh no!
What do you think?
But then you'll leave me, and then everybody listening will leave me,
Uh-huh.
and then there will be dead air
You're
on
going
the
to be
floor.
all alone
Oh
in a
no!
hostile world. Yes. Well, maybe I will, maybe I won't. I don't know yet. There's only one way to find out. Yes, let's put this fear to the test. Yes.
Okay.
Let's see what happens if you go pee in the middle of our podcast.
Okay. Do I have to chug all this coffee?
No, I mean I don't. Do you enjoy your coffee? And
Yes.
you know, you still can disrupt.
You're not a monster. Agent of torture, yes. Monster, no.
No, this is not torture. See, this is what the problem is, right? People see ERP as torture. However, when it's done right, yes, it's hard. It's probably one of the hardest things people are going to do. But it's not torture. It's hard. Kicks ass hard, yes, for sure. But it's not torturous. And it comes to the point that it's torturous, then it's something wrong with the delivery.
Yeah.
Yes, because it means maybe it's too much too fast. So, the treatment has to be calibrated. The success of treatment, lies in that, balance between, not too much, not too little, right?
Goldilocks.
Think about it. This is people's comfort zone, right? Doing things right outside of the comfort zone. You do it long enough, you get used to it, right?
Yeah.
That's what you achieve habituation. And then do things that are now outside of this comfort zone increases further doing. If you jump all the way there, it's going to be torture, and that's not what we want. Yes. So 0 to 10, where is your anxiety now about disrupting our wonderful session?
It is like at least a 7.9. It's pretty-
7.9.
Yes.
Okay, what is the fear? The trick is always name the fear. What is the fear?
The fear is that I am going to be so disruptive in this podcast that you will be inconvenienced and leave, that the people listening to it will be like deeply disappointed and leave, and that they will never come back, and that this podcast will be an absolute failure and I will die alone. I don't know if that goes to die alone, but like ultimately, like this podcast dies. And
And so what? If this podcast dies, what's going to happen? What's the worst case scenario?
so I noticed that battle starting up between the like rational and irrational, right?
Tell me the irrational. That's all I want to hear. We need to bring it out
Okay.
to the surface. Do not
go.
push it back. Do not rationalize it in a way.
Oh, Brenda, come on out. Okay. So if this podcast dies, then there will be a series of lemony snicket unfortunate events that unfold. So one will be that the people who would stand to benefit from listening to this podcast and get some sort of helpful small step that they can take in their own recovery won't have access to that information. And so not that I'm actively harming, but I'm preventing them, like my needs will prevent other people from like having access to
Yeah, that's one powerful P.
It really is. So there's that. Additionally, I would like this podcast to be a brilliant highlighter of the brilliant clinicians that work at our clinic, and for people who want services and to have access to services to get to meet clinicians who can do this kind of work with them, and to know that how to access them. So it'll be taking away both from like listeners, potential clients, and it'll be taking away from the people who show up on the podcast because then they won't get the clients that they need, and then everyone will be very upset with me. Well, which is also a part of it. I will fail.
You will fail. So that's the core fear, yes.
Many, many things.
I will fail. At the end of the world, yes. That's another very common deep fear in OCD, right? Fear of failure, which feeds perfectionism. It's all kinds of things, yes. Well, there's only one way to find out.
You now, don't I? Okay. I mean, I don't have to. It's an option. You are offering it to me. I get to choose whether or not I test this.
Technical P.
Okay. I'll be back.
All right. So, just me now. Just to clarify, in the actual sessions, right, me as a clinician, right, I would get to know very well each person's presentations, right, the client. And before we would do any exposures like I'm doing now with Jenny, I would know where those would fall in terms of intensity of the anxiety they render, right? So, we will not blindly just do exposures, but do it in a very stepwise manner, right? Step by step. Again, reaching out of the comfort zone, getting used to the situation, and then reaching further and further until more and more fears are being conquered. So, this is a bit of a, in a way, artificial situation. And it's just an example of how exposures can work. It's anxiety is scary, but when these anxiety-provoking thoughts, the obsessions, the intrusive thoughts are brought back to awareness, into the light, it's easy to realize how, ridiculous and unfounded they are. So part of, digging for that deep fear, saying them out loud, it's the opposite of, avoidance. And a common avoidance in OCD is trying to shut down the thoughts, right? That's part of what we're doing, bringing them out, saying them out loud to realize, really? So you're back.
I'm back.
Uh-huh. Where am I?
You are right here.
So what happened?
Well, I went pee. Okay, so play by play. I ran down the stairs. And then when I ran into the bathroom and sat down, I'm still a little breathy. I realized I had literally run to the bathroom. And so then so then I peed and then I wiped, and I didn't wash my hands because why? And then
Because you wanted to come back fast too.
because I wanted to come back. You're
so
probably
I don't just hang up on you and leave you along with the whole world.
But you know what I did after that? Because I thought okay, Jenny, you ran down here. I know what that is. I know that is me rushing and getting through it as fast as possible. And so I put on chapstick. I know.
So you slow down.
Yep, I slowed down.
You did the opposite.
I did the opposite. Brenda was like, "You're going to need to move much faster, sister." And I just did the opposite. So I put on chapstick. And then I started walking fast, and I was like, whoa, 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 we're going to slow down. It happened so quick. And then I walked slow through my house, and I felt like I was in slow motion. And then I walked up the stairs, and then I walked around the corner, and I put on my slippers before I sat down. And
this is the perfect example of challenging the OCD, doing the opposite. Wonderful. Where's the anxiety now?
I mean, it's still high.
Give me a number, 0 to 10.
Probably still in the 7s.
How do you know your anxiety is a 7 versus a 5 versus a 3 versus a 10? What do you look at?
So when I feel, so I have in my mind a couple of experience that act as anchors for how I rate my anxiety levels. So a 10 for me is a full panic attack. I've had a panic attack before, and It was the moment where I thought that I had lost all of my Google Photos because they were attached to this old email account that got shut down through UW, and they had all the pictures of my dad in there. And so I was walking across the street. I tried to open a picture and I couldn't do it. It was like, your account's closed. These are all gone.
So the panic attack, how did it feel in your body?
Dizzy, couldn't see, like throat closed down, couldn't breathe, chest
Mhm.
like this
Yes.
like elephant on my chest, like tingly hands,
Mhm.
like no sound, like there was no sound anymore.
Good. That's your anchor for a 10.
Mm-hmm.
Yes.
Yep.
So anxiety is very physical, manifests very physically, right? So looking at our physiological reactions, it's a very good way to gauge anxiety because many times people gauge anxiety based on like, I don't like the idea of something.
Mm-hmm.
Yes. And they actually do not experience as much anxiety as they think they do. So what you're describing actually is a very good way to gauge anxiety, right? The intensity
Mm-hmm.
of the physiological reactions. How fast is the heart pounding, shortness of breath,
Mm-hmm.
muscle tension, shaking. It may vary from person to person. Good. All
Mm-hmm.
right. So before going to the bathroom, your anxiety was a 7. Yes.
Mm-hmm.
The fear was everybody's going to leave me. I'm going to be alone, and I'm going to be a failure. Yes.
Mm-hmm.
And where's the anxiety as you're coming up the stairs? Slow, forcing yourself to go slow.
Mm. It it was higher when I was opting to go slow. Yeah, and I wanted to bring it on. I want, like, I think I can handle it. Like, I think I can feel anxious. I know what a panic attack feels like. Survived that. Like,
Mhm.
but did I die?
Yeah.
So it was a little bit higher coming up the stairs, like going slow.
And once you sit down,
Yeah, I went down a little bit.
where would you say?
I mean, we're probably at like a 5 now. Like,
Mm.
it's akin to that. If you've ever almost been in a car crash, that feeling like when you,
Mm.
like right after it happened, there's this, and for me, I get sort of this like adrenaline dump in my arms,
Mhm.
and it's like whoosh, and it's not like real heavy in my chest, but yeah, it feels like all of the blood is like back to the limbs. You know, like everybody ejects out of my chest cavity. And it's like, okay, we're no longer, we are safe. Put the blood back in the body. And so then I sort of, yeah, so I feel that. That's my
Mhm.
5. I think that's
Mhm.
probably where I am right now.
What's the fear?
Um,
What's OCD telling you? What's Brenda telling you?
Brenda is telling me that we're going to have to wait to figure out if we're a failure,
Mhm.
and we don't necessarily want to wait
Mm.
for that. Like, we want to know right now whether or
Mhm.
not,
So it's
whether,
ambiguity.
yeah, yeah, we don't want to wait.
Mhm. The core of OCD, all OCD symptoms, it's this fear of uncertainty, right? People with OCD want 100% certainty. Yes.
Yeah, we
Well,
don't want to operate on statistical probability.
mm-mm.
We want to eliminate possibility so we can move
Absolutely.
forward with confidence.
100%.
Yeah.
Yes. Hmm. So what's Brenda telling you specifically?
Yeah, so she is telling me that I may have survived this specific incident with
Mhm.
you, but that we won't know about the podcast and whether or not this is a failure for maybe, because I think this will probably air in like 8 weeks.
What's the fear?
The fears that I will forget,
Forget.
that this is what we're testing, that we're testing something, and that I will
Mhm.
not, that I will be so unprepared when I do fail because I will be unable to trace it back to this moment. So it's like, she's like, well, if you, yes, like we're going to have to delay posting this and delay finding out if this causes us to be a failure. So we should probably post it sooner
Mm.
so that we can test it faster.
So this is what to do, right? Like Brenda is suggesting some compulsions
Yeah, totally. Yeah, she's like,
too,
do it now.
right? But what is the fear?
The fear is that am I afraid I'm going to fail to remember?
Mhm.
I think
Okay, so this is important, yes?
yeah,
Because your anxiety about, actually leaving the room,
yeah.
right? You said it was a 5, but it sounds to me what makes it a 5 now is actually a different fear. Oh my God, if I'm going to forget.
Yeah.
Yes.
Yep.
So what happens, all these fears kind of mixing together, and our anxiety about peeing, right, is misrepresented. That has nothing to do with peeing, does it, in a way? In many ways, largely, right? It's a different being. But now you attribute all this distress to peeing versus it's a thought that I'm going to forget. I'm going to miss something. I'm going to mess up in some ways. In other words, I'm going to
Fail. I'm gonna fail.
fail.
I'm gonna fail. I'm gonna fail.
Yes. So
Yeah.
it's another thought of
Yeah.
I'm going to fail. So if you were to, it's a little bit artificial, right? If we were to separate these fears, right?
Mm-hmm.
Being
No
a
problem.
minute ago, where's your anxiety about that?
Yeah. No, it's
Yeah. Right?
yeah.
Where's your anxiety now about I'm going to forget something important and everything is going to go to shit and I'm going to fail and it's over.
Yeah.
My life is over. My career is over. Everybody suffers.
Yes.
Patients are going to have no care.
Yes.
It's terrible.
It's like you live inside my head right now. It's like,
Yes.
yeah, you and Brenda.
And this is, the power of ERP, right? Being able to voice out loud. This is what I was saying when you were peeing, disrupting this whole thing. Yes, that voicing these fears, voicing our intrusive thoughts versus trying to get rid of them. It's actually a very powerful therapeutic tool because it enables our smart brain to kick in, make rational decisions, look through it. What happens is when this is our emotional brain, the fight or flight response, if you want, right? The limbic system kicking in, right? It's fear-based, it's not rational, right? But in our heads, all of these things make sense, yes? However, when we say them out loud, language by nature, right? It's more natural, and the centers that, produce and help us understand language and decipher language are in the smart part of the brain, rational part. So once we actually voice these fears, this enables our smart brain to kind of naturally sort through this and kind of realize this is fucking garbage. Excuse me. I didn't listen to my daughter. I did curse. Yes. And that happens automatically versus trying to convince myself. It's a difference between I try to convince myself something it's irrational versus I get it. Right? When you're laughing spontaneously, when you're saying out loud those fears, it's because you got it. It's ridiculous. Tend to dismiss, automatically, naturally dismiss the ridiculous. And this is a form of exposure, right, to this intrusive thoughts, to the fear, to the deep fears, because it's the opposite of thought suppression, which is very common, right? Get rid of the thoughts that bother me, right? I don't think about it. I don't even hear this a lot. I don't think about it, right? But trying to suppress thoughts is like trying to submerge a beach ball into water, right? The deeper you push it, the faster it comes back and bigger the splash. Right? And actually makes these thoughts stick more. Think about it. Don't think about the banana. Don't think about the banana.
Only thinking about bananas.
Don't think about the banana.
But that is all I can think about now.
Exactly. Exactly. Right.
This is such a curious experience for me because I had been noticing, and maybe this is me connecting the dots opportunity, but I had been noticing these little like sparks of anxiety showing up in my body over the past few weeks. And simultaneously within the past few weeks, I've gotten really involved with this project management software, Asana, and I've set up all of these projects for myself and all of these deadlines and all of these goals. And now that I'm like pressing into them, I'm like, oh God, like, first of all, like, did I even set this stuff up right? Like, did I fail at setting this up? Am I going to hit all of these like arbitrarily decided goals that I have set for myself with these projects that I have set up? And even now talking about this, I noticed that spark of anxiety right here. That's just like this sort of low level 3, like, oh God, are you going to fail at all of the things that you committed to yourself in this new project management software? And it's interesting for me to be able to wrap in like, oh, actually that is the same thought that's operating, that same sort of like, you're going to fail, that same intrusive thought that shows up much more quiet and much more masked, like many tiramisu layers back for the peeing. Like with the projects, it's much more front and center. It's like, yeah, no, you're going to fail at all of those projects that you set up for yourself. Like you have really shit the bed on like your timing and your project management, and like this is failure. And that's much closer to the podcast. But even the peeing stuff, it's so interesting that like Yeah, it's just dressed up. It's just dressed up differently.
Well, usually people have one or two fears and, just they take many different forms, right? But at the core, that's all there is.
Hmm.
It just comes. Can be about peeing, can be about the project, can be about what you wear, can be about your glasses, can be about your kids, can be about anything. But at the core, it's actually the same. Again, people have one or two core fears and they show up and, kind of figure out what it is and confronting that. It's really, really important, versus seeing it as something else because it becomes overwhelming, right?
Mm.
Feels like, we're never going to get anywhere, right? Because it's so much. But
Yeah.
it's not. It's just the same thing over and over again.
Yeah. Different outfits.
Different outfits.
Different outfits.
Yes. Mm-hmm.
Dina, you're great. I don't know if your daughter has told you that yet today, but
Yeah, I'm going to have to wait for her to get past the teenage years, and then I may hear it. Until then, hey, Jenny, maybe that makes me a failure.
maybe. But did you die?
It's my favorite thing. And by the way, I get this. I used to, train psychology residents and fellows in ERP, and a bunch of them, one class actually, they got me. It was part of the gift, and it's my favorite thing ever.
Yeah. I, that is wonderful because it shows that not only did they learn, but they get you.
Yes, and maybe my style as a therapist is not the most orthodox, but I think that's what it takes in order to be an ERP therapist because you have to develop, some um, tougher skin in a way, right? Because, we get into this field because we care about people. And many times we confuse care with cuddling and accommodating. And actually what happens, we end up accommodating people's symptoms versus actually helping them get better.
Mm.
So, and the treatment is not always about getting rid of the anxiety. It's about living to the best of your ability with anxiety. Anxiety is part of life.
Mm-hmm.
Maybe you have these bouts of anxiety, but it doesn't stop you from doing things. And this is actually at the core of success. It's about the anxiety not stopping us from doing what's important to us. Getting out of the habit of acting on those emotions. And we do that. People do that in every aspect of their lives. We don't act on our emotions, actually. So ERP is a lifestyle that we actually use in everyday life in order to be successful and make it. Think about it. I mean, every day I wake up in the morning, I don't feel like working. Don't. But if I were to give into this feeling, well, I wouldn't have this conversation with you. Yes, I would be a failure. So what do? I go to work, right? To do the opposite. This is not just a ERP thing. This is a life thing. That's why it's a lifestyle, right? I have to clean my house soon a little bit. I don't feel like cleaning the damn toilet. I really don't. I'd rather not. Yeah, what do they think I'm going to do? But that's exactly what I'm going to do.
Clean the toilet.
Yes. I mean, I can go on and on and on about all the things that we do despite, everything in our being saying, don't.
Mm-hmm.
And this is what makes us function. And most people actually with OCD do that in many aspects of their lives, except for these core fears.
Just like one thing. Yeah.
Yes. And yes, you may fear failure, but it doesn't stop you from trying things and risking failure. That is successful. That is success.
I mean, that's actually why I opened the business, is because I've always wanted to open the business. I've always wanted to be the gatherer of brilliant clinicians who practice from the same stance and to create a space. And I was terrified to do it. And I thought, well, damn it. I know, I know how this works. I know I have to do the thing. I know this might be a colossal failure. It might go for 20 years and then fail. It might go for 20 minutes and then fail. But either way, I need to do the thing and see what happens in the meantime. That's why I'm starting the podcast, because that same principle. It's like, I know that I'm terrified of failing. And so I'm going to do it.
I'm going to keep trying.
I'm gonna
You're
see
going
what
to keep putting yourself in the positions to taking a risk. And this is it's not about not having fears. Oh, God's sake, we all have fears. Yes.
happens.
It's about not acting on those fears and let those control our lives. Yes. So you know what? Keep being afraid, but don't let it stop you.
Yeah.
That's the trick. I was quite terrified of this podcast, actually, since it's my first. So.
Okay, so debrief. How did it go? What has happened?
Oh my God, what if I fail? Yes. I think we all have, a fear of that in a little bit. But,
Yeah,
you know,
functional.
what's going to be, I'm going to deal with it. That's another piece, right?
Yeah.
Well, if this is disaster, well, I'll have to deal with it. I'd rather not, but you know what? We'll deal with it.
I can.
Yeah, I mean, I'll find out.
Yeah. Yeah, that's helpful. Yeah, I bet I can runs the risk of reassurance.
Mm-hmm.
Mm-hmm.
It does.
Yeah.
Yes. But,
Yeah.
there's only one way to find out.
Do it.
Yeah, just do it.
Yeah, jump.
Yeah. All right.
Adina, you're a brilliant you're a brilliant podcast guest, and I think also a brilliant clinician. Where can people get more of you? Say somebody wants to work with you, how can they find you? Tell them now, tell them here.
Well, through West Coast Anxiety website, all I have to do is a quick Google search, westcoastanxiety.com, and here I am. Here we are, as a
Here
matter of fact.
are. I love it. I love it.
Yes.
Any small steps that a listener who really resonated with this might take in the next week or towards something that that matters to them?
Well, maybe it's a lot of things, but I think the most important is that OCD anxiety doesn't go away. It may wax and wane over time, but it doesn't go away and it doesn't get better. It tends to grow over time. And as terrifying as it may be, get treatment and get specialty treatment. Unlike most mental health issues that respond to a bunch of different treatments, OCD really doesn't. So getting good specialized care, which is hard to find. It's very hard to find, sadly so. It's very, very important. OCD is one of the most missed and confused diagnoses out there. Times people are diagnosed all kinds of things. In my career, I saw people with OCD diagnosed with everything under the sun, and OCD is missed. Part of the reason is because OCD can take so many forms,
Okay.
and unless you really are familiar how it looks like, it's going to be missed. And misdiagnosed with generalized anxiety, social anxiety, depression, bipolar disorder, personality disorder. That's a very common misdiagnosis. It's quite a bit, and there were studies that showed that time frame between symptom onset to actual treatment can be more than 10, 11 years. I think it was 17 years if I remember the data. And other treatments may look nicer, but they are not particularly useful. And actually some can be detrimental because it's very easy to develop additional obsessions and or compulsions, including mental compulsions as a result.
So maybe a small step for someone who's already in therapy, who listened to this, who's resonating with this, maybe a small step might be just to ask their therapist if they know how to treat OCD. And if so, like, what is the treatment for it? So a small step could be just to check in with your therapist if you're already seeing someone. And then if you're not seeing someone and this really resonated with you, either reaching out to us at the West Coast Anxiety Clinic or reaching out to a local provider to you and asking them if they know how to treat OCD.
There are a few other steps, right? Look at your progress, in whichever form of therapy you are in, I've been in therapy for 6 months, a year, and you haven't made any progress in terms of better functioning, or just kind of like feeling good in the moment. Maybe it's time to, question whether, hey, is this working for me or not? Again, not necessarily to question the therapist. We all have our, specialties and strengths, and, there are issues that I don't work with because I'm not very good at. Yes. So it's not about that, but it's about making sure that you get the right treatment. And in addition to what you said, Jenny, about do you treat OCD? Do you do ERP? It's also a matter of how much of your caseload
Mm.
is, OCD and anxiety disorders. Because it's one thing to treat one case here and there versus doing it day in and day out. And the reason that's relevant is because, again, OCD literally takes hundreds of presentations.
Yeah.
And without a lot of experience and exposure
Yeah.
to that, it's going to be hard to find the right approach, right? It's, one size does not fit all. So, in the absence of this extensive knowledge about OCD, it's going to be much harder to get the treatment that's absolutely needed for each person.
Mm-hmm. Yeah, so you're really going to want someone who has a high number of people on their caseload that are currently being treated for OCD. And what I hear you saying is that the philosophy under that is that because OCD has so many different presentations, you want someone who is experienced at seeing all of the different presentations, the topography, all of these different topographies, the lay of the land, and who has experience being able to really drill down into those core fears that are actually quite limited when we really
Yeah.
think about it.
And to actually design,
Mm.
the treatment in a way that's relevant for each person.
Mm-hmm.
Because some presentation can be quite odd, and unless you have a lot of experience, it's very hard to design the exposure exercises that are needed, and in a way that's gradual enough to be effective.
Yeah, and targeted. Yeah, helpful. Okay, so the walk-away steps are if you're in treatment, you're resonating with this, but you're not making the progress that you would like to make. And the way that you assess for that has my life changed in the way that I want it to, or am I sort of doing the same stuff and living the same life as when I started therapy? If it hasn't changed, asking your therapist some really specific questions. Do you treat OCD? Do you do ERP? And if you do those things, how many on your caseload are actually are you doing this with right now? And then if you're not in therapy and this resonates, starting that reach out process to some specialist and recognizing that when you're working with a specialist, they will be able to really craft a treatment plan that is gentle enough for you to be able to get some traction in it and challenging enough for you to be able to make really big, meaningful changes in your life, even if it's sort of like slow goings at times.
You didn't fail at the summary.
Don't reassure me, Adina. Okay, thank you. Thank you so much for joining me today. Thank you, everyone, for listening to the Values Forward show. We have another episode coming out in 2 weeks. Make sure you check back in for that. And there will be all sorts of goodies in the show notes, so make sure you check into that. Follow us on YouTube, subscribe, please comment in the comments below if you have any questions for Dr. Adina Aldea. Make sure to ask her and call her doctor and make her very uncomfortable and remind her of her authority. And if you have any questions for me, please post those as well. Happy to share. Thank you so much for taking the time, and share this with somebody that you think might need to hear it.
Thank you. Thank you. It's been wonderful. Yay. Let's do it again.
Hey.